beginner hip, ankle, and foot mobility drills.
Here's a quick video to help you loosen up your hip and your ankle and foot at the end of the day. So if at the end of the day, your leg's feeling really heavy and you're having a hard time going up and down the stairs, you're probably hurting your back compensating for it. So here's a quick routine that you can do along with me to help you get mobile so that you can go up the stairs, liberate your hips, your foot, and your ankle, reduce inflammation, and have better range of motion, better movement. So first, what you're gonna do is we're gonna work on loosening up our deep lateral rotators. So on an ottoman or your couch or your chair, you are gonna put your foot in front of you, crossed over, and you can wave your knee in and out. It's like you're oiling the joint. And you can, if you can, drop lower so you get deeper into the stretch. You should be feeling it in your hip or in your glute. And we'll do this for about 30 seconds, which is about 6 deep breaths. Make sure that you're strong on the leg that you're standing on. You're not hipping out like this, because then you won't be getting the effects that you want on the side that you're stretching. Okay, that's good. So lower this foot and let's do the other side. Standing strong on this leg, bring this knee up, this leg up, rest your foot sideways. The objective of this exercise is to eventually be able to have your lower leg parallel with the ground. So this is an adaptation so that you can eventually get there while you're still working on loosening up your hips and creating that range of motion. Excellent. Lower that foot down, control. Now we're gonna get into our hip flexors a little bit. So placing your knee on your ottoman or your chair, step the other foot forward, and you are going to pelvically tilt. So I'm going to show you from the side. So put your knee down, other foot in front, and this is your pelvis. Imagine it's a bowl. You're going to pelvically tilt posteriorly. Okay, so like this. You'll feel it in here in the front, and we're really getting your hip flexors. Stay nice and tall. Breathe into this space here. What happens is we spend so much time seated that our hip flexors get very tight, and we end up compensating with our low back. And instead of getting our hip into extension, we tend to use our low back. So this is really great. We're going to release the anterior chain here, release your hip flexor, give your back a break, and enable your glutes to work afterwards, because this side is released, so the posterior side, the muscles can engage. After about 30 seconds, stand onto the foot in front, hold on to the wall if you need to, and come to standing. Now let's do the other side. So, rest your knee, step in front, do that pelvic tilt. You want a trick when you're doing the tilt, squeeze your glute. It's as if you're trying to tuck your tail under. You're bringing your xiphoid, your pubic bone to your xiphoid process right here. So it's as if you're crunching your abdominals without actually doing a crunch. You're just engaging your core, squeezing that glute, getting that deep, nice stretch in here, opening up your hips. It's important to breathe through this. This should not be painful. If there's any pain, back off. And make sure you report it to your doctor or your physical therapist so that they can address that issue. All right, now stepping onto this leg, come up to standing, lower that leg down. Your hips should feel a little looser and you should be able to walk a little more comfortably. Now we're gonna work on the lower leg. All right, now we are going to move down to the lower leg and to the foot and help release any of the tension, adhesions we have there, and enable the inflammation to get resorbed up into the system, and so we reduce some of that inflammation and discomfort. So what I want you to do is take your yoga tune-up balls. If you don't have yoga tune-up balls, then you are going to take your tennis balls. Ideally, if you have 2, put them in the bag, tote. It's a little easier to control. And we are going to start by rolling up the bottom of our feet. So remember that when you're doing rolling out your foot, it's like when you're vacuuming, you want to do all of the floor, not just the outside. So make sure that you are rolling up and down. Make sure you're getting the heel. I want you to picture all the joints, the articulations, so see if you can get between them. And then because they're toted, you can get to the sides of your foot. And you can pause this video and spend more time rolling. You can easily do 2 minutes per foot, and it'll be really beneficial, really great. Now what you're gonna do after getting most of the underside and the sides, put your foot down and roll that ball on top, and it'll help you get into some of the adhesions. If you need to, you can hold on to the wall for your balance. Really try and get all of that stuff in here, because sometimes the inflammation even accumulates on the top of your foot and it's a harder area to get to. So now that we have rolled that all out, we are going to go into a great calf stretch. So put the ball underneath the ball of your foot, so right in here, and lower your heel to the ground. Make sure that your toes are pointing straight ahead, and the foot that's not on the ball is going to dictate how far you stretch. So the more you move this foot forward, the more intense the stretch is. Make sure that your knee is straight for the stretch. I'd like you to do at least 6 deep breaths in this position to really get a nice release in your gastrocnemius and your soleus muscles. All right, so after about 60 seconds, 60 breaths, about 30 seconds, what we are going to do is plant that foot down, and we are going to bring that foot behind and stretch the front of the foot. So you want to hold this for about 30 seconds. If you feel up to it, you can roll your heel in and out, really getting more into those articulations, so your talus, your tarsals, and your digits. All right, switching to the other side. So we are starting by rolling out the bottom of the foot. So going up and down the whole length. You know, when you think of your feet, they're very complex. It is the part of our body that has the most muscles and bones. So there's a lot of things to work through, and a lot of moving parts. Because we wear shoes almost all the time, a lot of these muscles aren't working, and we miss out on all the proprioceptive, which helps with our balance. So rolling out our feet helps engage those muscles, helps them move independently, and then I highly recommend walking barefoot if you can, if you're comfortable with it. Is we are going to plant the foot on the ground and roll the ball on top of our foot, breaking into that adhesions, kind of working between all the tarsals, creating space. It's a bit of fascial work, it's really great. All right, so now what we're going to do, we've loosened up that, we are going to stretch our calf again. So place your foot on the ball, lower your heel, keep the knee of the foot being stretched straight. And this is really a focused stretch on your gastrocs. We are getting into the soleus a little bit. If you really want to stretch both of the calf muscles, then with the soleus you would need to bend your knee. But for the purpose of this video, you can just keep your knee straight. Again, hold this for about 30 seconds. And now we are going to stretch the front of the foot. So bring the foot behind you, and if you want, you can bend your front knee and go even more into the stretch, and you'll feel it come into the front of your thigh as well. You can roll your heel right to left, breaking down the adhesions again a little more, getting more movement. I'm going to hold this again for about 30 seconds. Coming out of this, now we are going to roll out the shins, so the anterior compartment of your leg. So you're going to get onto your hands and knees, take the ball, and we are going to roll it on either side of your tibialis bone, right here, okay? So on your hands and knees, you're going to roll forwards and back, breaking down the adhesions in your anterior tibialis muscle, Okay, so if you're getting shin splints, this is going to be uncomfortable, but this is really going to help with recovery. So rolling up and down, you might find an area that's a little gummier. You can stay focused there. You can try and roll your foot in and out to get deeper into it. Point your toe away, point your toes back. What's really important is in this position, you breathe through any of the discomforts. Holding your breath is not ever a good idea. Okay, and so again, you could easily spend a minute or two rolling out this area. We are now going to line it up with the other leg. And so again, placing the balls on either side of your tibialis, rolling up and down that bone, really getting into our tibialis anterior. You might find that the insertion up close to the knee is a little more gummy. Spend a little time in there. That's where I like to spend a little extra time. And just roll it in and out. All right, so after having done this whole series, if you want to keep going, we have another video for feet. So I recommend you try out the feet video. It's about 5 minutes. And if you enjoyed this, please like and subscribe to our channel. We do offer some coaching online, so if you're interested in having a clinical eye guide you through your rehab, then please contact us. We're also working on some rehab programs that we're going to be offering online. So the first one will be for the hip, the next one will be for the thoracic spine, and eventually for the ankle.